Welcome back. In the city of Chicago, officials are monitoring 4 key metrics when it comes to deciding to roll back the mandates: COVID cases, positivity rates, hospital admissions, and ICU COVID patient census data. Now, 3 of those 4 metrics were required to be at a lower transmission factor by CDC guidelines, and the latter 3 metrics are all within that range at this time. While COVID cases are still at a substantial transmission factor, cases have fallen in Chicago by 37% in the last week, dropping to 283 as of Monday. Well, joining us for more on the situation in the United States is Dr. Damilola Adeyemi, is the Medical Director, Antimicrobial Stewardship Program, Swedish Hospital, North Shore University, Chicago. Thank you for joining us on the program.
Thank you for having me.
Now, Doctor, what does the data say about where the U.S. is going in the pandemic?
Well, so the number of cases has, dramatically reduced from when we had our surge in the middle of January last year. So cases have, in general, in the United States, have come down by over 80%. Hospital admissions are going down as well. ICU, number of patients in the ICU are reducing as well. And the death rates is beginning to go down as well. So we're moving in the right direction at this time in the United States.
Are you happy with it? Because, I mean, the method in the U.S. is pretty much being criticized compared to perhaps some other parts of the world, the U.K., also Europe. And then we also have those who have said, they don't believe in the vaccines. Do you think that, the U.S. is right now on the right track?
Yeah, I think the U.S. is on the right track, but we could do better. Overall, in the country, about 65% of people have been vaccinated. The data is clear. The data is very clear that this vaccine helps. This vaccine prevents severe illness, and it also prevents hospitalization and death in people who are vaccinated. There's the CDC data that came out last month that showed that amongst people who are 65 and older, the death rate amongst people who are boosted versus people who are not vaccinated is reduced by almost 90. The number is actually 88 times lower in people who are boosted. So we know that the data is clear. There's no basis for argument about that. But there are a lot of things that come into play with this. So people are still getting exposed. Even though I told you earlier that the number of cases is it's gone down, is nosedive down, we are still having over, quite a number of cases every day being reported. And our death rate is still like, almost 2,000 daily. So there's still some work to be done, but I believe we're heading in the right direction. It's just we need more people to get vaccinated and people to just follow all those mitigation strategies that we talk about. And if for people who've been vaccinated, to get the booster shot, because we know for older people, the booster really helps.
Dr. Adeyemi, tell us a bit about your experience. You traveled to Nigeria and back to the U.S. during the years of the pandemic. What have you noticed about both countries under the pandemic?
Yes, thanks. So I just left. I was in Nigeria about a week. Yeah, I left on the 13th to come back home, and I was in Nigeria for about 6 days. So I would say it depends on where you go to. So it was a mixed feeling. On landing at the airport, a lot of people were wearing their masks. People were sort of distancing as much as they could. So I was impressed. I mean, it was not crowded. Like I said, it depends on where you go to. So there were some centers that I went to where you couldn't enter if you didn't have a mask on. And there were places where I went to where there was really nobody wearing the mask. It was, everybody was just going about their daily activities. So that was a little scary. People were going about their normal duties. So it depends on where you go to back in Nigeria. And it's really interesting and puzzling, that the way the pandemic hit the U.S. We've been very lucky in Nigeria that we've not had that kind of impact.
And even for the African continent, which a lot of scientists are still trying to discover exactly what could be responsible. But then, what would you say is an unforgettable experience as a doctor under the pandemic?
Oh, unforgettable experience is seeing young, young people who have a bright future who just refuse to take the vaccine, get infected, and then die. That is heartbreaking. Is what I would say. People who those are preventable deaths. Seeing people dying when it could be prevented it's heartbreaking. Is what I would say. And that toll. There's a toll on frontline workers, nurses, respiratory therapists, nursing assistants in the hospital. Everybody is having a toll of this disease. It's like the number of cases when we're in the surge now, everything is relaxed and cases have come down. We're still having cases, but when the Omicron came and there was the surge, end of December, beginning till the middle of January, till mid-January, basically, it took a toll on frontline workers, just like throughout the pandemic as well. So what I would always take with me is the fact that there were a lot of people whose death could have been prevented just by taking the vaccine. Now, there was a time we didn't have the vaccine. So, you couldn't really say much about, you couldn't blame those people that were just a little bit unlucky or they had other medical conditions that put them at high risk. But since we've had the vaccine and there's clear data that shows that these vaccines, not just one, prevent severe illness, hospitalization, and death. I think it's a no-brainer to be vaccinated at this time. It's a no-brainer to be vaccinated and boosted if you're eligible.
Some experts have said perhaps infodemics is the cause of that, and that can also be attributed to the question surrounding the origin of COVID-19 and the conspiracy theories following that.
Sorry, what did you say was the conspiracy theory about what?
So, I mean, based on from what you've said now, experts put it under infodemics that is spread all around COVID-19. And this also is where you talk about the origins of COVID. Where did it come from? How did it come into Wuhan? Who exactly brought it? And then the conspiracy theories around that subject, because many people are still questioning the definitive evidence before the world as to, the origins of COVID-19.
Yes. Well, we right now, scientifically, we believe it came out from Wuhan and came out, and that's the belief right now. But all these other conspiracy theories that you're talking about, we have a pandemic at hand, and the most important thing is to save lives, to prevent people from dying, and so we can deal with that. And I'm sure that if there's any doubt about if there was anything fishy about the origin of this virus, we'll get to know eventually. But the most important thing now is to prevent people from dying, and that's what we want to do.
We appreciate your time. Dr. Damilola Adeyemi is the Medical Director, Antimicrobial Stewardship Program, Swedish Hospital, North Shore University, Chicago. Many thanks for joining us at this time.
Thank you for having me.